Let's talk now about something that maybe very well has hit your home front or a loved one or someone that you know of. And it's one of the major killers in the United States, heart disease. Do you know that on annual 700,000 people a year die from heart disease? That's roughly 30% of all Americans that suffer from some form of heart disease. The most commonly diagnosed form of heart disease is atherosclerosis, which is a thinning of the arteries due to calcium buildup and plaque in the arteries contributed to or exacerbated by chronic inflammation. Now, there's a little bit more that I'd like to talk to you about when it comes to the thinning of the arteries or the plaque that is being built up in them. There's a term or a substance that really gets demonized as being bad for you, which is something called cholesterol. So I want to give you the physiological breakdown as to how cholesterol becomes the problem, but it's not the problem, it is there to protect you. So your arteries and your blood vessels are very soft. So once you put your body into a state of chronic inflammation, continuous exposure to sugar, you start to weaken the blood vessels and the arteries. So now they start to crack a little bit. Your friend cholesterol that's flowing through your blood every minute of your day, your brain is 80% cholesterol. Cholesterol coats every nerve from your brain to your toes, is just flowing through the blood. So now you start to get a little chink in the armor, you get a little crack. Cholesterol comes and shows up as your Band-Aid, and cholesterol starts to patch it. It would be like you punched a hole in your wall, oh, I gotta get out the drywall and the spackle. That is the cholesterol. It starts to correct the damage to the artery or the vein. But if you continue to consume sugar and put the body in a state of chronic inflammation, the cracks get a little deeper, they get a little bigger. So what must your body do? Build up more cholesterol. So is cholesterol really there as the enemy or the demon? Or is it your ally that's there that's trying to protect the damage that you're putting on the body? The problem is with continuing to eat the diet that is causing the damage to the blood vessels, cholesterol becomes the enemy. So do we ever really want to decrease cholesterol production because of our dietary habits? No, we don't. To gather and get more information on this from a person who is a specialist in the field, there is an amazing ethical physician currently right now based out of Scottsdale, Arizona, or Phoenix, Arizona, excuse me. His name is Dr. Jack Wolfson. Check out Dr. Jack Wolfson. Check out a book that he wrote called The Paleocardiologist, where he talks about how to reverse heart disease and how you're able to not become a statistic of a heart attack or a stroke or one of these other aspects that happen with heart disease. Check out Dr. Jack Wolfson and his book, The Paleocardiologist.